Hi, my name is Tim Bale and I'm co-director of the Myelin Institute at Queen Mary University of London. Welcome to another in our series of videos on the COVID-19 crisis. In this video, my Queen Mary colleague, Dr Andreas Papamichail, speaks to three experts on how the COVID-19 crisis is playing out in Syria, in Palestine and in Lebanon. Those experts are Dr Abdulkarim Ekzayez of King's College London, Dr Weeam Hammoudeh of Birzeit University and Dr Nassim El Achi of the American University of Beirut. If you find this video useful, please do share it with anyone you think might be interested. Please do subscribe to our YouTube channel and please do come back for more.
Hello, my name is Andreas Papamichail and I'm a lecturer in Global Health and International Relations at Queen Mary University of London, where I specialise in global health security and the politics of global health. In this latest installment of the Myelin Institute video series on the coronavirus pandemic, we turn our focus to the Middle East and specifically looking at Lebanon, Palestine and Syria. This partially builds on the video from a few weeks ago when we talked about kind of the intersections between conflict, forced migration, and the kind of the politics of pandemic response. And to give us their insight, I'm joined by three colleagues and friends. First up, we have Dr Abdulkarim Ekzayez in the bottom right corner, who's a trained medical doctor from Syria and currently a research associate at King's College London and also a member of the Syria Public Health Network. In the top left corner, we've got Weeam Hammoudeh, who is an assistant professor at the Institute of Community and Public Health at Birzeit University in the West Bank. And last but not least, in the bottom left corner, we've got Nassim El Achi, who is a postdoctoral research fellow at the Global Health Institute at the American University of Beirut. Thanks very much to all three of you for joining us. I've got two questions for you. So we'll start off with just the one question, have you all answer that, and then I'll come back to each of you with a follow-up question after that. But I was wondering if you could just start off by giving me a brief overview of what the current situation with respect to COVID-19 is in your countries. So in terms of the number of cases, what the lockdown situation has been and so on. And maybe Kareem, we can start off with you.
Yeah, sure. Thank you, Andreas, and thank you for hosting us for this video. Talking about the COVID-19, as we see that even developed countries and health system, the most advanced health system, they are struggling in responding to COVID-19. So when we talk about conflict-affected countries in the Middle East, I think it's important to highlight the challenges, but at the same time, any good practices that might be the case in some countries. So talking about Syria, as you know, because of the conflict, Syria has been divided into at least three main territories. One controlled by the Assad regime in the central and the coastal areas, and one controlled by the Syrian Democratic Forces and the self-administration in the northeast, and one controlled by opposition armed groups in the northwest. So in each area, the COVID-19 outbreak was different, and also the response by the health system was different. So the Syrian Ministry of Health, the Damascus one, announced so far 47 confirmed cases of COVID-19. And they were a bit slow in confirming the first case, especially in light of the open border policy with Iran. And you know, Iran was kind of a hotspot in the Middle East in the beginning of this outbreak. So researchers were expecting that Syria, especially Damascus and the regime-held areas, were having higher number of confirmed cases of COVID-19. However, the Ministry of Health were slow in reporting, and also it was expected that the confirmed numbers so far are much less than the real numbers. This because first, the lack of testing capacity by the Ministry of Health, but also because of the different political political reasons behind lack of reporting. In terms of the other territories in the northeast, there has been only one case that died in Qamishli city in the northeast, and in the northwest there has been no cases of any confirmed cases. And maybe I will focus more on the northwest of Syria because it's the in the most affected areas by the conflict. And looking at the weak health system that was affected mainly by attacks on healthcare and by lack of resources, this area is under a higher risk of the COVID-19 outbreak. But despite this, there has been no confirmed cases. So there has been some good practices in terms of the preventative measures that have been taken by the local authorities in the region, but also more importantly, by the different grassroots organizations and civil society organizations. And maybe we can talk about the response later.
Great, thanks, Karim. And like I said, we'll come back to you to talk a little bit more kind of the politics of the response in the second round of questions. Weeam, maybe we'll go to you next.
Yeah, so right now, as it stands, we have an estimated 547 confirmed cases. And that includes 355 in the West Bank, 20 in Gaza, and 172 cases that have been added, but these cases are in East Jerusalem, and there's an issue with also the lack of jurisdiction on the Ministry of Health's inability to precisely get the numbers. We've been in a state of emergency because of the pandemic since March 5th, and that was when the first cases were confirmed in Bethlehem, and they were traced back to some tourists that were visiting in Bethlehem. And immediately Bethlehem was sealed off, and then a state of emergency was declared later that evening. And so it began with a ban on any sort of like large gatherings. Schools and universities were closed, and then things got gradually stricter in terms of stricter curfews, and then only essential businesses opening. As of about 2 weeks ago, there has been an easing of restrictions in some areas, especially now the districts that don't have any active cases. And over 60% of the confirmed cases are now inactive. So 367 people have been cured. And we've had 2 deaths that were confirmed by the Ministry of Health in the West Bank, and then 2 deaths that have been sort of confirmed in East Jerusalem to the ministry. The problem with East Jerusalem is because, yeah, like I said, because of the lack of jurisdiction, we don't really know how big the problem is. But the ministry has actually been actively trying to do what it can in terms of contact tracing from the very beginning. So they were able to isolate people that had been in contact with confirmed virus. There's also been an ongoing epidemiological survey, so like where random samples were taken to try to get a sense of how many undiagnosed cases there might actually be in the population. So they've been active on that front, and the early lockdown measures have actually helped also minimize, and we haven't had any new cases for the last 4 days so far. So hopefully things are looking up, but you know, it's not to say that there can't be another outbreak. And I'll say more maybe about the issue of jurisdiction when we talk in the second question.
But it sounds like a generally quite proactive response. Great.
Yeah.
Thanks. Nassim, maybe we'll come to you.
So when it comes to Lebanon, we were actually a few days ago, we were kind of really happy that we almost contained the spread of the outbreak. We have actually one of the lowest number of deaths per million worldwide. We have around 845 cases which are infected, only 4% of them which are of unknown source, but all of the rest, they are traced and isolated. So things are almost in control. We are now in the phase of doing random testing everywhere throughout the country, and up till now we are having around 0.2% of the infection rate, which is really low, which again is an indication that the things are under control. We were like actually in the second phase of the exit strategy plan that was done by the Ministry of Public Health. However, unfortunately, like 2 days ago, one of the Lebanese expats who came back from outside of Lebanon, although he was tested negative when he did the PCR test at the Rafiq Hariri airport in Beirut, unfortunately later on he did not abide with the regulations of self-isolation and ended up spreading the disease to 33 other people. So a lot of people now are saying like probably we are starting another phase, a second wave of the infection. And now nothing is eased anymore, and probably like today we are going to have a curfew at night.
Okay, thanks, Nassim. That's a new curfew then, or?
Yeah, it's the same as the one before, but before we had they ended the curfew. We had a better, more easy mobilization, but now it's not the case anymore. They want to control the spread as much as possible.
It just goes to show that the response to this virus is not going to be linear, is it? It's going to be kind of...
No. It's like one person doesn't abide to the regulations, it messes up everything.
Absolutely. Great. And I think, Nassim, a little bit later, you'll talk a little bit more about the situation of some of the refugees that are hosted within Lebanon's borders.
Yes, of course, yeah.
Thanks. Okay, so that was the kind of the quick overview. So now maybe we could delve a little bit more into the kind of the politics of the response in each of the countries that you're talking about or living in. So we'll just go around the same order then. Starting with you, Karim, maybe you can tell us a little bit more about the politics of the response.
Yeah, so as I mentioned, Andreas, in the first question, the Ministry of Health of Damascus, they were criticized of slowing the announcement of the first confirmed cases. And there were a lot of political reasons behind this slow in confirming the first case. However, after this, the Ministry of Health announced a lockdown, but this has not been respected that much across the regime-held areas, mainly because of the socioeconomic status of the population and the high poverty rate. When it comes to the other area of controls in the northeast and in the northwest, in the northeast, I think the political status of this region is affecting the response largely because, for example, for the surveillance system, in Syria, there are two surveillance systems. One is run and controlled by the Ministry of Health in Damascus, and the other one is run by the Assistant Coordination Unit in Gaziantep. So one is more kind of covering the regime-held areas and the other one covering the opposition-held areas. And for the northeast, this area falls in between. So it really does not fall under neither of these systems. So in some locations, for example, in Al-Raqqa or Deir Zor Governorate, you would have the same village claimed to be covered by both systems, by the early warning and response system by Damascus and by the early warning and response network of Gaziantep. And this is causing confusion even for health facilities in that region, to whom to report and how to monitor cases. In the northwest, maybe the political reality of this region was a protective measure for COVID-19, because this region, the northwest, is naturally isolated from all other parts of the country, because it's under the opposition and some Islamic groups' control. So this region has been isolated for the last few months, especially considering the political and military advances and developments that were happening between April 2019 until January and February 2020. So this has put the region under a little bit more protective status compared to the other regions. And that could be the reason that there has been no confirmed cases. But also the local authorities in the region, influenced by political motivations, they cut the borders. They closed all the borders between the opposition-controlled areas in the northwest and all the regime and the Kurdish territories in the northeast. And also in terms of the border with Turkey, because Turkey had kind of military operations in the region, they were very much involved in these kind of measures, because they have currently more than 15,000 troops on the ground in Idlib region. So there were some tension about the possibility that those troops might be a source of infection, or the other way around, that this region might be a source of infection for those troops. So it could be the reason that the military operations in this region has been freezed. So there was a lot of tension in January and February with, some agreements between Russia and Turkey to reach to a ceasefire. But then, because maybe of one factor could be the COVID-19, all this has been freezed until this moment.
Okay, that's really interesting, Karim. And could you're involved in some work to respond to the pandemic, is that correct? Maybe you quickly outline what that is.
Yeah, just quickly, and I think, I would like to highlight these initiatives by different local groups, because, in the Northwest, there is no central government, there is no state in this area. So local technical bodies, for example, the health directorates, the civil defense, the white helmets, they took the initiative of starting to mobilize all resources in the community, and they announced a campaign called Volunteers Against Corona. And this campaign has been so far very active, and I think they have at the moment more than 2,000 volunteers in each single neighborhoods in the region. And also there were some other initiatives. For example, I was involved with an organization called Violet to develop a website for self-assessment. So this website has an algorithm to identify suspected cases through assessing symptoms and also assessing risk factors, travel history, and some complications of the disease. And based on the assessment, the website will advise or will recommend few measures for the people to take. And this has been in coordination with the health actors in the region. So the website is linked with a referral system to refer suspected cases when needed.
Great, thanks, Gary. So lots of kind of grassroots organizing going on. Great. Thanks. Weeam, maybe we'll come to you next again.
I think in terms of the politics and the response, there are lots of issues around borders and jurisdiction, like I said before. And maybe we can start with Gaza, with Gaza, for example. Because it has been isolated, and most of the cases that were confirmed in Gaza were people coming in through the Rafah borders. And thankfully, because they had set up these isolation areas before they actually entered, so they were caught before they mixed in with the general population, because there was a lot of anxiety and worry that if the virus were to spread in Gaza, it would be horrific because of just the overpopulation. There are lots of issues around sanitation, access to water, and other things. So it's been mostly contained there, but there were issues at different points in times with getting testing materials and getting other medical materials that the Israeli military was blocking. And today, there hasn't been the same sort of access to testing kits in Gaza compared to the West Bank, for example. So that has been one major issue. In the West Bank, like I said before, initially the first cases were due to contact with tourists that were visiting Bethlehem as part of a larger tour. And they had sealed it off, but then after that, the next outbreak was basically from Palestinian workers who were working in Israel. And there had been an arrangement between the Palestinian Authority and the Israeli government for these workers to actually have access to testing and to health services. But that wasn't followed by on the Israeli end. And initially, even before these cases were confirmed, there were a few cases where workers that were suspected of having COVID were actually just thrown at checkpoints with a high fever. I mean, in both of those cases, it ended up not being COVID, but rather, like a flu or other conditions. But so that created a lot of anxiety. And then there was an outbreak in one of the areas northwest of Jerusalem, and so in an enclave in the West Bank, and it was discovered because one woman who had gone to the hospital and she was diagnosed and then died later that evening, and she was the first person to die from the virus, and then it was later discovered, and then so they started testing her contacts in the immediate family, and then there was, and then in that area, within I think about a week or so, almost 100 cases were discovered. And in those areas, there are areas where there are different administrative classifications. So you don't really have control over borders. You don't have control over, like, even making sure that when workers are coming back, they're being tested properly and whatnot. So that was one of the major things. And then since then, there was more pressure to actually place greater restriction. I mean, restrictions or oversights in terms of the mobility of workers, because at that point, I mean, even now, the cases in Israel are much higher. So you have almost, it's close to 17,000 cases compared to about 400 or so within the West Bank. But the lack of control over borders, and then also the lack of access to certain areas is a major issue. And there are other areas, for example, like in the Jordan Valley, where the Palestinian Ministry of Health is unable to go because of issues around jurisdiction, and also some areas that are classified as Jerusalem but are outside of the wall. And even when they've tried, and like some local organizations have tried to go into those areas, sometimes the Israelis have, the military would come in, take down any sort of billboards with the Palestinian Authority signs without actually then offering services to people that are technically part of the Jerusalem municipality, for example. So this has been one of the major things. And this is also one major source of anxiety, because later on, basically, the agreement was that the workers would stay for a period of 2 months or so until the lockdown measures were over, and then they were supposed to have access to medical services in Israel. And recently also there was a court case by an Israeli rights NGO where they actually pushed for health insurance for the workers and were able to achieve that last week. So there's more is being offered to the workers, but at the same time, there's still a lot of anxiety about when they actually come back, because they are more in contact with Israelis, and you have a much higher, much greater spread of the virus. And if they come back all at once, the healthcare system can't possibly deal with between 40 to 60,000 people all at once. So this is still one of the areas that's giving a lot of people anxiety. And I think they're trying to streamline it to as much as possible, and also trying to work on the, public relations messages to try to encourage people to abide by isolation and quarantine, drawing on these past experiences. But yeah, this is also one of the things where jurisdiction and lack of control over borders, also sometimes like getting testing kits and medical equipment has been delayed because it's had to go through approvals and things like that. And so we see it coming together in COVID as well.
Great, thanks, Weeam. You really get a sense of the kind of the physical and legal fragmentation of Palestine. Great. And Nassim, again, last but not least, we'll come on to you.
Okay, so when it comes to Lebanon, things are a bit different. The first reported case was in February 21. Starting from that point, everyone panicked. Seriously, they panicked because we are really well aware of the capacity of the public health sector that we have. Why am I saying this? Because 87% of the tertiary healthcare facilities are actually private, and 80% of the budget of the Ministry of Public Health goes to covering the bills of patients who are administered to the private hospitals. So this means that our public health sector is deprioritized, lacks the capacity in order to actually deal with a normal disease, let alone an outbreak. So even the government was well aware of that. That's why a lot of restrictions were done really early. We acted really fast. All of us wore masks, gloves, using sanitizers all the time. At the individual level, I'm saying restrictions, lockdowns were done. Actually, after 3 weeks from the first reported case, a full lockdown of the country took place. And again, schools, universities, even within the first week from the first infection. Other than that, the thing that made people panic more is like the models which were done by a lot of research centers. Let's say about the Global Health Institute. Let's say they said like if people do not abide to the regulations, we'll end up having 20,000 cases between February and March, which was like tragical, knowing that we only at that time had 7 ICU beds in all of the country. So building on this, what happened is that the community abided to the regulations in order not to flatten the curve, but actually smash the curve. And that meanwhile, the Ministry of Public Health was doing a great job with the government and a lot of other stakeholders in order to increase the capacity of the public hospitals, and that not only in Beirut, the capital, but rather throughout the country. So now we can say that all of the, let's say in all of the country, we have public hospitals are capable of receiving patients with COVID-19. Other things which I will call like points of strength, the media played a very important role in raising awareness everywhere among the people. Research centers, they did a lot of forecasting, modeling. I will talk about, for example, the Global Health Institute. We were aiming to actually push the academic awareness within the lay people, which is not very common in Lebanon, who actually don't, they think researchers are in their own bubble. So it was one of the chances for us to show no, researchers can do something, awareness, modeling, forecasts, and what so on. Another thing is that for once the Lebanese were capable of uniting together to face one thing rather than fighting. We have a lot of political and economical instabilities and crises at the moment. So for one time, they all united together, and we just collected a lot of funds, whether internal from the local Lebanese or from the expats. But a side note, we are in Lebanon 6 million people, the expats are around 12 million people. So we collected around millions of dollars in order to support the public hospitals, the Lebanese Red Cross, which is doing an amazing job, along with in order to help people who actually lost their jobs because of the COVID-19. So as I told you before, we were doing a great job. We were actually planning to do the exit, we were actually in the second phase of the exit plan. Now I don't know what's going to happen later on, but at least we trust that we have now faith more in the public sector and in the way that the government is acting, along with the other stakeholders, of course. 2 minutes regarding the refugees, despite the fact that the Palestinian refugees and the Syrian refugees are treated in a totally different way, but for some reason we are there's a direct communication between those who are in the Palestinian refugee camps in Lebanon. The Palestinian factions were actually in charge of the Palestinian refugee camps in Lebanon and not the government. So there's a kind of communication in order to make sure that there won't be any kind of outbreak within these refugee camps, knowing that they were built at different time frames, so the infrastructure isn't very good, densely populated, there's a very big possibility of having outbreaks. Luckily for now, we have only 1 Palestinian refugee which got infected, and now she's treated at a public hospital in Lebanon. Regarding the Syrian refugees, 60% of them actually live in urban areas with us, so what applies to us applies to them, which is great. However, the most vulnerable ones who actually can't afford to rent houses in the urban areas and actually live in more in the Bika and what so on, daily wages, they actually don't live in refugee camp, not even camps, barely anything. They don't have the luxury of washing their hands while singing a happy birthday song, okay? So that's why the NGOs are doing a lot of they're doing a lot of work there in order to make sure, to spread, for awareness, hygiene, providing them with money in order to support themselves. And luckily, things are still under control, and we haven't got any outbreak for the Syrian refugees, especially those who are living in these irregular settlements.
Great, thanks, Nassim. Some of the things you said about the awareness of some of the shortcomings of the health system resonate a little bit with what I know of what's been happening in Greece as well. So an awareness that 13 years of austerity and financial crisis has actually weakened the system so much, led to a kind of really far-reaching and quite effective response, which stands in quite stark contrast to some of the hubris that's characterized the response here in the UK. So that really resonated with some of the things I've been hearing from Greece.
I totally agree with you. And again, there's one thing that I need to highlight. For some point despite the fact that we have a severe economic crisis, we never had this debate of wealth versus health. It was always health as a priority. So this is why probably the way we dealt with the outbreak was for me, I consider it really professional.
Great. So thanks to the three of you for joining us. I hope the people watching found it as informative as I did. Thank you for joining us.
Thank you very much.